Okay, so in addition to the American Societies for Cosmetic Surgeons, Colombia has a very high standard as well. And the acronym for them is SCCP, I believe. Yeah. And it stands for the Colombian Society of Plastic, Aesthetic, and Reconstructive Surgery. Very high standards. They've been around for 60 years. So, you would want to at least do your research on that. And of course, if you come through me, I've already done the research for you. And I can assure you that the doctors that I have are up to standard. Or actually, I shouldn't even say that. I take that back. They're above standard. So, what are the reasons why, women would want surgery or why I want surgery? Because I want to keep it on me, because I'm the one who's going to be getting it done in a couple of days. So I'm 68, as a lot of you know, and so there are lines on my face, there are wrinkles on my face, there are sagging places on my face that I am not ready to deal with. I am not interested um, in having that look right now. So, uh, there are some things that you can use that's non-invasive. You have the Botox and the fillers and all that stuff. I tried the fillers. I didn't like them, and I do occasionally use Botox. Now, um, the eyebrow lift, this area right here with a frown. I don't know if I can do it. I don't even know if you can see it. Oh, okay. I think this is it. I personally don't like the frown. And I know that in order for me to see it, I have to be frowning. So, but I don't like it. So, um, the eyebrow lift would take care of that. Um, the Botox takes care of it as well. And I think for the most part that I'm just tired of that. Um, the eyes, the this area of the eye, this area right here, I would like to shorten that skin, because when I put on makeup, my makeup kind of gets lost in the folds. I don't like that. Um, and underneath, I think I have a little bag I see under one eye. I would like to get that removed. So then you have this area right here, the jowls, the chin, and the neck. I would like for them to tighten that up as well. Now, although I'm 68, and yes, why do I want to do all of these things? Because I want to. Because I want to. Because you could call it vain, um, that I'm into myself. I am still into myself. Um, I do function without all of those things. I do like makeup. Um, and I I just think that if there's something that I want to change or enhance, that I could do it or should do it. Um, and that's pretty much it. There's other reasons why we shouldn't do surgery, and surgery can help a relationship. So you need to know that. That's a whole together different topic. Um, let me see something. I think I forgot to do this. My glass is even clean. So you get to see me. Uh, so as I said, there are reasons why we shouldn't do. Relationships is definitely not one of them. Um, and if you think that it's going to make your relationship better, don't do it. Now, if you want to do it for yourself to enhance your relationship is fine, and you just want to, you know, enhance it, then by all means, do it. Now, some of the other reasons why people get um, cosmetic surgery, other than the lines and the wrinkles and the sagging, is, uh, for a better presentation, like on their job, like maybe if they're looking for a job, and of course, age discrimination is definitely um, out there. So you want to look as fresh and crisp as you want. Um, you have um, you may have some fat that you just have been working out and eating right, and it's just not working. As in my case, um, the, the the muffin top, whatever you guys call it, I call it a protruded abdomen. I don't want it anymore. I've done as much as I can, and I'm sure I can do more. But guess what? I don't care. I don't care about that. And I am going to get the tummy tuck. I was really trying not to do it because I have no scars on my body and I didn't want any. But I surrendered and I'm going to get it. Because, once you get the lipo, it's going to remove all that fat, and then your abdomen is just going to be hanging and sagging. And I don't want that either. I want it to be tight, and if I can see abs, that's good. It's not a requirement. The other thing that, see, another reason, um, people shouldn't do it, or why they do it. And some people don't do it for ethical reasons. They feel that, oh, um, this is what God gave me, and I'm going to age gracefully. Well, that's good for you, and I'm glad that you feel that way. I don't feel that way. So, um, I think a person should do whatever they feel is something that will enhance their life. I don't have a problem with that. I basically am doing it for a number of reasons. Some of those that were listed, and also I just want a refreshed look. I just want to look like I just came back from vacation. And most people that know me won't really even know. Or even if you didn't know me, you wouldn't know, definitely. But people that know me won't even know. They may know something is different, but they're not going to really be able to put their hands on it unless I tell them. And I think the other, if a person, I don't have any disfigurement from an accident or something, but that's another reason why a person would, well, actually, my nose is kind of disfigured, and it's been that way for over 20 years, and I'm just sick of it. Like, I really don't want to um, look at this nose again because there's two different nostrils. I just want one nostril, one or the other. So that's one of the reasons why I want to get the cosmetic surgery. Now, like I said, I mentioned um, one of the reasons why we get cosmetic surgery is because to enhance, basically. And we need to have realistic expectations. We can't expect like just tremendous weight loss as a result of getting, a tummy tuck or liposuction. We still have to eat right. We still have to exercise. We still have to walk. We still have to do the right thing for the right reason. and at the right time. So that is the number uh, one of the essential reasons, or should I say, it's one aspect of cosmetic surgery. Having a plan, knowing what you want, and going for it.